Hi, Paul Silovsky, physical therapist and owner of Rebound Physical Therapy. And today I want to talk to you about the causes and remedies of carpal tunnel syndrome. So briefly, to explain what is carpal tunnel, it includes a set of symptoms that occur in the wrist and hand area. It can be pain, numbness, or tingling in the wrist area, thumb, index finger, middle finger, and half of the ring finger. So that would be the numbness or pain sensation. Usually starts in the wrist area. And what it's caused by, fundamentally anyway, and because you can get symptoms like this, it can contribute by things that are coming all the way from the neck and the first rib area. But when it comes to right down in this area, there's a nerve that travels through a tunnel that's created by the bones in your wrist and your wrist going into your hand, and that gets closed down or encroached upon. So there's a nerve and blood vessels that flow through there, and when they get impinged upon or entrapped through either inflammation or closure of that tunnel, closing down, then you get these numbness symptoms, pain, tingling, any combination of those things that can occur with activity or even at rest. It's quite annoying, quite frankly, when you get it. So what causes this? What can cause an encroachment or entrapment of the nerve and vessels in that tunnel? Are chronic overuse or repetitive stress, ergonomic positioning and incorrect positioning. You're working with a mouse, I'm being exaggerated here, but working with a mouse and compressing that tunnel chronically, or banging a hammer, anything that would be repetitive or postural ergonomic in nature, or just over time as your body changes, as you get muscle imbalances and or inflammation or enclosure of that tunnel. Because it can be temporary too. You can just anything that inflames it or closes it down and pisses off, if you will, the nerve and the vessels going through there, you get those symptoms. Now, I'll also tell you or caution you that when you come see a physical therapist, we're going to look all the way, starting up in the neck, because the nerves that supply that tunnel start in the neck and go down underneath the clavicle area here, because I've had people that I've treated with carpal tunnel where you stretch out their upper quarter or upper arm, their neck, and even sometimes release some pressure around their first rib. You can give some relief here too. So we often find that poor posture and muscular imbalances or changes in the whole upper quarter and neck area contribute to carpal tunnel-like symptoms. While we'll definitely treat this area with manual therapies and modalities to decrease inflammation, we'll use the manual techniques to free up scar tissue, open up, make that tunnel more pliable, get the nerves and the vessels and the muscles and tendons through that area gliding more smoothly, because when you get inflammation, things get kind of sticky and inflamed and put pressure on the nerves. So we're going to reduce the inflammation with treatment modalities. We have many modalities that we can use, beyond just heat and ice. Our manual therapies, definitely postural improvement exercises, stretching exercises, and then showing you ergonomically how to get your keyboard or your mouse in the right position, how to be right positioned correctly at your desk, or protective wear if you're doing manual labor and repetitive work. Many times people will wear night splints too to keep that tunnel open and not allow it to close down and get those tissues some relief. So there's many things that can be done to treat carpal tunnel syndrome. Really important to know what causes them, and then knowing what you can do for your body based upon your posture type, your movement habits, and how you can decrease the inflammation. We're here to help you with that. Love to educate you more about this subject and take a look at your body if you're having problems with carpal tunnel type symptoms, because it's quite annoying and it's actually pretty easy to treat. Look forward to helping.